Hi, I'm Kevin Shaw from OrthoCincy. I specialize in sports medicine. Today I'd like to talk about meniscus tears. These are very common injuries that patients come to see us for when they have a twisting injury or sometimes just pain for a couple weeks or a couple months that they have no reason for. The pain usually is around the inner part of the knee, and it's described often as a catching or a locking pain that's very unpredictable. Even just getting out of a car or making a small twisting move will cause that sharp pain to occur. Sometimes there's swelling and sometimes there isn't. Most of the patients really don't know what's going on, they just know it hurts and it's very aggravating to them because they're having difficulty doing their normal activity. Common symptoms with meniscus tears include pain and catching symptoms. Sometimes patients will say there's a popping or a sensation that there's something stuck in their knee as they try and get up out of a chair or simply make a turning maneuver. The pain located around the inside of the knee or the back of the knee is very typical as well. Basically, there's pain along the inside and the back of the knee that's very unpredictable for the patient when they're trying to do their normal activities. When I see swelling, there's typically something inside the knee irritating it, and the most common thing is the meniscus tear. When we examine the knee in the office, typically we're finding that there's pain along the inside part or the outside part along the joint line. The joint line is right between the two bones of the femur and the tibia. So when we push on that area, if it causes pain and there's swelling, that's a telltale sign that there may be a meniscus tear. The next step is usually to have an MRI performed, which will show us the inside structures like the meniscus specifically. So the next question is, what do we do about a meniscus tear? Unfortunately, the meniscus does not have a very good blood vessel. Therefore, when it does tear, it doesn't heal very well. It is not like cutting yourself at the skin or tearing a muscle where the tissue typically heals on its own. So treatment options for a meniscus injury include basic symptomatic things like ice and anti-inflammatory medicines on the initial outset. However, with a meniscus tear, often there's enough symptoms that patients want something done to actually fix the problem. This is where surgery comes in, and unfortunately for most meniscus tears, the patient needs surgery. When you have surgery, it's a general anesthetic typically that takes anywhere from 15 to 30 minutes to perform the entire operation. 2 small openings are made in the front of the knee, and instruments are placed through those little holes so that we can see and work inside the knee. Water is used inside your knee with a very good camera and a bright light so that we can see all the findings on a monitor. A small shaver tool and a scissor are used to trim away the edge of the meniscus where it is torn. 2 small band-aids or stitches will be used to close the holes, and the knee will be wrapped up with a small dressing and you go home. The recovery from a meniscus injury and having surgery is usually in the range of 4 weeks. Of course, some patients who are younger might heal in about 3, and some who are older who have a little bit of arthritis might take 6 or 8 weeks. Typically, you're on your feet, not using crutches after about 3 days. Physical therapy is typically needed for about 2 to 4 weeks, depending on how quickly your strength and motion returns. You can expect a full recovery and get back to your own workout or your regular job within about 4 to 6 weeks. Thank you for watching this discussion about meniscus tears. I hope it was helpful.